Okay, I'm Professor Drake, one of the consultants. Just got a little tiny bit of bleeding after the baby. We're just going to sort this bleeding out. You're going to be absolutely perfect.
The COVID-19 pandemic provides new challenges for the safety of people receiving and providing maternity care. This video illustrates good practice for managing obstetric emergencies in a woman with suspected or confirmed COVID-19. The video was created in collaboration with a number of professional organisations and also draws on the views of over 100 specialists in maternity care, infection prevention and control, and human factors.
Oh dear, I'm just not feeling so well, Jane.
Here, a woman with suspected COVID-19 has given birth, but has started to bleed. A midwife assesses the woman, raises the alarm, makes sure her baby is safe, and encourages her to lie down.
Lower the bed down because I think that can make me feel Yeah, she's going to be fine. We've got the team coming.
Obstetric teams are used to responding to emergencies, but they need to keep themselves safe while doing so. The first responder finds out that the emergency is postpartum hemorrhage and confirms it using closed-loop communication.
Kathy, we've got a PPH. Please could you call the emergency team and ask somebody...
Closed-loop communication is a way of avoiding errors. For example, by repeating back an instruction to confirm that instruction has been correctly understood.
Okay, so it's a PPH, you need the emergency team, and I'll bring...
Ideally, once any task has been actioned, its completion should also be confirmed.
And I'm just going to rub your tummy.
A single-use grab bag containing everything needed for a single emergency is used instead of a standard emergency box to ensure that the minimum of resources are taken into the room when dealing with the emergency. The first responder tells the other team members what the emergency is,
So we've got a PPH, it's a lady with suspected COVID.
so they can don the appropriate PPE.
Okay, so if I don first as a senior obstetrician...
As this is an obstetric emergency, the senior obstetrician takes the lead. The team leader assigns roles. In this example, the first responder is assigned as a clean runner, who stays outside the room and helps the team don PPE and get extra equipment if needed. The team leader prioritises the team members who need to act first and therefore don PPE and be ready first. Donning PPE as a team saves valuable response time. Make sure the donning station is laid out in line with human factors principles. For example, place the PPE in the sequence it will be used and make sure the station layout is standardised. Every team member should adhere to infection prevention and control principles with excellent hand hygiene and appropriate glove use. Use labels for team members wearing PPE to indicate their roles. Ensuring the team leader enters the room first means critical decisions can be made more quickly. Clear communication is vital in emergencies, but more challenging when wearing PPE.
So we're just going to get a few things organised, sort this bleeding out, you're going to be absolutely perfect.
Keep the woman and her partner updated about what is happening. Be aware that wearing PPE may make it harder to communicate and may increase the mother's fears as well as those of her partner.
The situation is that we've got an atonic PPH.
Yeah.
The background is Sean's had a long labour.
To improve communication when wearing masks, try to maintain eye contact and think about tone of voice and body language towards the woman and her partner. Take the same steps when communicating with team members. Use clear and standardised communication and ways of working. Standardising the content and layout of the grab bag helps to ensure a smooth response to the emergency. It is important that the team managing the emergency is kept informed and updated through the use of meows charts and objective measures.
Sophie, I've got the PPH checklist for you.
Yeah, sure. Thank you very much.
These include weighing swabs to assess the blood loss and the severity of the postpartum hemorrhage.
The bleeding's settling down. Now we just have to go to theatre just to check everything inside. I think we just need to get ready for a transfer, Sophie.
Okay.
A safe transfer route to theatre needs to be decided for each maternity unit and should be specific to the local systems and protocols. Ensure that all required teams converge at the theatre at the same time. After dealing with the emergency in the room, follow the correct order of doffing as specified by national guidance. Doff gloves and gown inside the room into wide-mouthed bins with fully opening lids. Clean hands with hand gel. Outside the room, make sure there's a clear demarcation of dirty and clean zones. Doff contaminated masks and hats outside the room, in the dirty area and into designated bins. Wash hands with soap and water after doffing. Organise a debrief meeting for the team involved as soon as is practicable in an area away from the room where the emergency occurred.
About it, we want the minimum number of people, don't we, that's going in the room. So clearly we want...
As well as discussing the clinical management of the emergency, the team can consider the differences in care when a woman has COVID-19, so that learning can be shared with other teams managing similar emergencies. It's important that team members feel they can speak freely and reflect on learning without psychological concerns. Take the time to refine, test and train the procedures for managing an obstetric emergency in women with suspected or confirmed COVID-19.